Hi, I'm Dr. Ron Miller of cashbasedphysiotherapy.org, and today we're answering the question, why giving away free information or free seminars or free ebooks or free downloads doesn't work in a cash-based setting. First, I must apologize. There's a tropical storm, Colin, coming through here, so we had to move everything inside. So we're not outside today, but normally you have a nice view with either some sort of Florida weather or like a lake behind me and stuff like that. But today we're inside and we're going to go over why giving free information or having free seminars doesn't work in a cash-based setting. So let's take a step back and look at in a normal standard insurance-based clinic. Whether you're targeting Medicare patients or any certain type of diagnosis using health insurance, this strategy works great. You can market it, have a seminar with 30 people who want free information, and you're going to give them free info and educate them and try to convert them into a patient because they don't have to pay anything, maybe a copay. Okay, or you could use this to target Medicare patients with stenosis. You know, they're going to fall into this. You're going to gather 30 or maybe 10 or 50 people who download your ebook, or maybe 10 or 15 people come to your seminar. And they'll learn it and they'll commit to it because they don't have to pay for anything. So in a standard insurance-based clinic, whether you're targeting Medicare patients, a certain diagnosis, or anyone using their standard health insurance, you'll be able to get them into the funnel real quick and work them into having new patients with a high conversion rate in a standard insurance-based clinic. But let me tell you the number one reason why this does not work in a cash-based clinic. The main reason is because you're putting yourself in front of people who want free information. These aren't the right people who are going to commit to a cash-based practice. So you're setting yourself up for failure. And some of the problems who people are trying to take this marketing strategy and implement it to a cash-based setting is that they will tell me that, well, I had 5 people download my ebook and I had no evals from it and no new patients. Or they'll say I had 10 people attend my seminar on back pain, but no one committed to a evaluation and no one committed to being a new patient. And that means that your marketing is not working. Okay, so let's take a step-by-step approach of why. Okay, so normally you use some sort of strategy, or step one, use some sort of gimmick or strategy to get their attention to make them want to download it. This is my revolutionary treatment for low back pain. Find out this secret to plantar fasciitis or something like that. So you're already starting off on the wrong bat and you're building false rapport with them. You know, people do business with who they like and trust. So you have to earn their respect and you have to be the expert. And normally you're trying to gather them into some sort of marketing strategy that, you know, really sets the standard so high and it gets them like wishful thinking and hoping that they're going to resolve their pain. Okay, so you're gathering them in there, and then 2, you're going to give them free information. Why? Because they want free information. So you're just giving away free stuff, and then you're gathering all those people up in either the seminar or some sort of webinar or some sort of ebook who are searching for free information. So they're not the right person for the cash-based clinic. So when they're searching for something for free, you're going to give them something for free. Okay, and then that leads to the third point, is that they're not committed. They're committed to nothing because they have nothing invested in this of why they would even try to spend money on this. So when you give something for free, there's no commitment level in this. So you're going to run into that same problem if you use this strategy in a cash-based setting. You'll have 10 people show up for your seminar, 0 people are going to commit because they're going to back away whenever you start to say, well, it's $150 for an eval, I should be able to handle this really quick. But as soon as you say that $150, they're going to back away because they're searching for free information. They don't want to pay for this. So, and then you're going to run into excuses. You're going to hear them all. They're like, well, I have to think about this. Well, I need to run this by my spouse. Well, this isn't the best time for this. Well, this and well, that. And you're going to run into excuses. Okay? When they start to make the excuses, that's a no. That's a missed sale opportunity. And you're going to set yourself up for failure because, again, you're gathering all these people together who have back pain, but they want free stuff. So they're not the right person for you and they need to be referred out, you know, to a standard insurance clinic. They're not the people searching for your services, okay? And then the fourth step is that you're going to start chasing them around. You're going to be sending emails and voicemails and giving them phone calls, and they never call you back, and you're wondering why. You had 10 opportunities, you had 10 people attend this lecture, you did a good job, and no one came in for an eval, and no one committed to being a new patient because they want free stuff. Your marketing is gathering all these people who want free stuff. They're not committed to it, and then you're left with an unproven marketing strategy, and you wasted your time, and you didn't get any revenue from it, nor did you get any sales from it, and no new patients. So this is why using the free report or the free marketing strategy does not work in a cash-based clinic. So I hope you enjoyed this video. I hope it gets you thinking, what kind of marketing strategy should I be using in a cash-based setting? Should I even try this or should I not? If you have any questions for me, please send me an email. If you like this video, please share it on Facebook, and thank you for your time.